cover intubation.
Intubation. How do we spell intubation?
Intubation. Welcome Tuesday morning. So we're going to talk about intubation today. We'll talk about extubation on Monday, and we'll talk about airway problems and emergencies and a little bit about trachs on the Tuesday of next week. So we'll break it up into a couple days. And then also you'll get plenty of time to practice. This one takes a lot of practice because you're gonna have to learn how to intubate properly and extubate properly and a couple other things along the way. So you'll need plenty of time. So what are reasons that we intubate somebody?
Patients not protecting their airway.
Okay, inability to protect the airway, number one.
Inability to ventilate.
Inability to ventilate.
And oxygenate.
Not just you, who else? Dennis.
Yeah.
What's the reason we'd intubate somebody? We can't protect our airway, we can't ventilate.
There's two more, right?
Yes. Good start.
I can't think of them right now.
Their respiratory distress.
And that not by itself.
Respiratory failure, acidosis.
Oxygenation problems. Oxygenation, inability to oxygenate, and you missed the simplest one of all, which everyone does, which is apnea. Yeah. So inability to ventilate, inability to oxygenate, can't protect their airway, and just plain apneic. They're not breathing. When we talk about things like respiratory distress and post-op and things like that, we're going to talk about those in respiratory failure, which will be a couple weeks, and they'll fall under like inability to ventilate or inability to oxygenate, but we just use general categories for right now. So 4 reasons. Everything but inability to protect the airway would be automatically followed by a ventilator, but today we're just talking about actual intubation. So just because someone can't protect their airway doesn't necessarily mean that they need a ventilator as well. We don't see it much anymore, but it is important to understand that you could just intubate someone because they can't protect their airway, but they're still able to breathe. So they don't need to necessarily go on a vent. We would put them on a T-piece, which is like a cool air mist with a T-piece on the end of it. I'll show you because people usually are not sure what I'm talking about until I bring it out. But we'll talk about that later. So those patients are intubated solely to protect their airway. So like a burn patient, a patient with a tumor, upper airway obstruction, things like that. So in those instances, we might just give them humidified oxygen. Again, we don't see it very much anymore. It does come up on your boards sometimes where you've intubated a patient, their ventilation is fine, their oxygenation is fine, but they couldn't protect their airway, so we had to go ahead and put the airway in. Likely to be an endotracheal tube, but also could end up being like an emergency crike or a trach, given the situation, depending on what it is. So, are there any contraindications to intubation? Possibly facial trauma, yes. You might have to just put a trach or an emergency crike in its place. If you have extensive jaw, mouth, some kind of trauma like that, then you're not going to be able to intubate your patient. What else? There's one other reason.
Or DNI.
DNI, do not intubate. Burns, a lot of times we can get them intubated if we intubate quick enough. A trauma would fall under just facial trauma, you know, upper airway injury. So DNI, DNR, we're not going to intubate those patients. DNI is just a do not intubate. DNR means do not do anything. Do not resuscitate at all. So you'll see those various forms of advanced directives in the clinical site. So do not intubate, we might put on BiPAP, but we're definitely not going to put an endotracheal tube in. Any questions on that? What could be some hazards or complications that arise? Infection. Yeah, it would be more related to VAP, yes. Ventilator-associated pneumonia.
Airway spasms?
Yeah, you could have airway spasms, but that would be more while we're trying to put the tube in. Then you might have a problem getting the tube in.
Bleeding?
Oh yeah, for sure. You get somebody who's just hell-bent on getting a tube in and they can't, and you cause all kinds of trauma, which would also lead to swelling. Yeah, you can have vocal cord trauma.